Hi everyone, my name is Nosheen Reza, and I'm a fellow at the University of Pennsylvania and a member of the Circulation COVID team. I'm joined today by Dr. Cynthia Dougherty, the Charles and Gerda Spence Endowed Professor in Nursing, Vice Chair for Research and Education at the School of Nursing, and Professor in the Department of Cardiology at the University of Washington. Dr. Dougherty is also the chair of the American Heart Association Council on Cardiovascular and Stroke Nursing and is a nurse practitioner in cardiac electrophysiology at the Seattle Veterans Affairs Medical Center. Dr. Dougherty, thank you so much for joining our initiative, Circulation COVID Updates from the Front Lines.
And thank you so much for this important invitation to join you today.
Thus far, in our Circulation COVID series, we've spoken with physicians from around the world about their experiences caring for patients during the COVID-19 pandemic. Today, we are hoping to hear your perspective as a nurse and as a leader working in the COVID-19 hotspot in the United States. I wanted to start by asking you how you think nurses in the field of nursing have been affected by the COVID-19 pandemic, and if there are aspects of the COVID-19 experience thus far that you think have been particularly challenging for nurses as compared to other health professionals.
So thank you for that important question. And I think there is no doubt that nurses have been affected severely by the pandemic that we're experiencing, and maybe more differentially than other health professions. And what I mean by that is that many more nurses have more contact with patients in the hospital setting in the amount of time that they spend in intensive care units and acute care units than other healthcare providers might spend, which then offers them more opportunities, or to their detriment, more exposure time to individuals who have been infected with COVID-19. Also, nurses are the majority of the healthcare providers that are doing most of the screening for COVID virus, either within the medical center or out in parking lots or schools across our communities. Nurses are also triaging patients as they come into acute care facilities with symptoms of COVID, and they are taking care of patients by telephone in many COVID call centers across the United States. So just by virtue of the fact that nurses are in more contact in time with patients who may or may not be affected, they are differentially more exposed to the virus. The other thing that's happening in the Seattle-King County area is that nurses who are not involved in direct COVID care in certain areas, such as outpatient clinics and other settings, are being laid off of work. And instead of being able to be reassigned to work directly with the pandemic, some of them are losing their jobs or being furloughed right now. We also heard about a week or so ago that the first nurse that has died from COVID has been reported in the state of New York. So nurses are being affected severely by the COVID virus, but in many instances are rising to the challenge to support patient care throughout the country.
Thank you so much for sharing those important points, certainly about occupational exposure risk, because I do think it's a very important conversation to have and information to share. So I wanted to ask you next, how are things going in Seattle, now almost 3 months after the earliest cases of coronavirus were reported there?
So in Seattle, things are moving along. As everyone knows, the first case, or we think the first case, of a death from the virus occurred in Seattle, Washington, and that was in the latter part of February. I think it was February 29th. It was soon after that our state and our governor were activated to pay more attention to that. There were a number of deaths reported in Kirkland, Washington, across the lake in a long-term care facility. That sort of highlighted the importance of the spread of the virus. So in Washington, King County, we've been on the Stay Home, Stay Safe initiative since March 25th, and that extends for us till May 4th. What also has happened is really encouraging and surprising is that we had a mobile Army hospital that was set up in our Mariner Stadium for 1 week, and there were no patients that needed that care, so they took down the hospital and left. Also, there was a planned Hope ship to be outside parked in Puget Sound. The ship didn't show up because there was no need for that type of care in Puget Sound. There are also multiple other hospitals that were set up in football fields across the city. None of those have been used. So we have been fortunate, I think, in that the impact for us as a city and a county has not been tragic or maybe as much as we would have imagined. We do have enough PPE. We did not exceed the number of ventilators or intensive care unit beds that were needed throughout the city. We did yesterday institute the new wearing masks for all contact for any providers that are in our university. So that's been new for us just in the last 24 hours. And that's really in preparation to help us to begin to do more elective procedures and begin to see patients in the outpatient setting again over the next several weeks. So I would say the statistics are promising and really are giving us a lot of hope that in the future we're going to find our way out of the pandemic successfully.
Thank you for sharing that information. I think going forward, many of us across the country and the world will rely on you and your colleagues in Seattle to continue to share this kind of information, as hopefully you mentioned you are over the peak. Now, finally, I wanted to ask you, and certainly as I alluded to in our introduction, you are a leader in clinical care, education, research, and administration. How are you coaching, guiding, and supporting your team members during these challenging times?
What I have been doing to support my team and patients during the pandemic is really to lean in, to step forward, and to accept more responsibility and to accept more work than I might otherwise. And I am inspired by our first nurse scientist, Florence Nightingale, who said that how very little can be done in the spirit of fear. And so I have really focused on moving forward and being unafraid. I have also, for my patients, called them more often to reassure them that their heart is fine and they're not having any cardiac arrhythmias, simply by reassuring them that everything is stable, they're less apt to come to the medical center to seek care when we'd like them to stay home. I've also been more often calling colleagues who may be at home ill with the coronavirus or think they may have the virus, and to support them while they're at home and encouraging them to keep moving forward and to let them know that we care deeply about them and we look forward to having them return to work. I've also moved forward with fierce persistence and continuing my own work and telling myself that I'm not going to be afraid during the time of the pandemic and not to be defeated by what's happening right now. I'm also exercising more, eating less, accepting help from others, and giving more support to others who may need it. I also have a son who is a physician that works in New York City in the emergency room. What I'm doing to support him is to send him thank you notes to let him know that we appreciate the care he's giving to patients there. I also bake his favorite treats and send those to him in the mail. So in summary, I have been doing as much as I can in my own work to support others, to move forward without being afraid, to lean in and to step forward and take on more responsibility than I might otherwise in order for all of us to survive successfully with the pandemic situation.
Thank you so much for sharing those lessons and for taking the time to share all of your experiences with the Circulation COVID team and with all of your healthcare colleagues around the world with us today.